Here is a very interesting article that was sent to me by a friend who likes to argue with my brown rice, vegetable, bean recommendations. And it talks about the shape of plants and foods and how they mimic some of the things that they have found to be very helpful with. For instance, avocados, eggplant, and pears target the health of a woman's uterus. Celery, bok choy, and rhubarb are good for the bones, and they're strong and straight and so on. And I thought that was very clever. Weight loss drugs may benefit diabetes. That apparently is the new direction. Instead of just giving those medicines which are going to affect the metabolism of sugar, what they're saying is the most important thing we can do is try to get the diabetic to lose weight, because 95% plus of diabetes is simply due to overweight and what people eat. And you may say, I know some people who aren't overweight. You're actually being kind. Remember the definition of overweight. Overweight is when you look down on your abdomen or their abdomen and you cannot see where the muscles meet the muscles. And the reason is there may only be that much, but there is that much fat which is hiding those muscles, and so they are, for the human biology, over fat. You may think that's radical, but it's actually insightful. And all I'm trying to do is offer you this information, an invitation for you to consider this. You are free to choose, but that is how healthcare freedom is reached. So the weight loss drugs are an antidepressant called bupropion, which is used in the treatment of smoking cessation, and naltrexone, which is a narcotics blocker. Now, all of these medications which help people lose weight and help them stop smoking sort of block chemicals in the brain that sort of stimulate us to keep going back and doing that behavior. The behavior of alcohol, the behavior of cigarettes, the behavior of French fries and ice cream and steak and Kentucky Fried Chicken or any fried chicken and so on. So when you give those, people sort of feel a little bit frustrated or down. That's why the bupropion is given, because it's a little bit of a mood lifter and a fairly safe one at that. So as a result, what the new direction in diabetes may be to treat with these better weight loss combinations than the old ones, the Redux and the Fen-Phen and so on. Here's an article that talks about body mass index, risk at age of onset of cancer of the pancreas. And all that says is overweight predisposes to the development of cancer. High glycemic meals impair endothelial function. A high glycemic meal is a donut or a cake or a cookie or sugar, or even for that matter, too much juice. And what it says is it affects in an adverse fashion the function of blood vessels, which is what heart attack and stroke are all about. Let's see here. Well, a couple of other ideas. I've talked to the owner-manager of the Emerald City Smoothie, which is out in South Windsor, to have the kinds of smoothies that I recommend. Also in West Hartford, there is Robex. So Emerald City Smoothie makes the kinds of drinks that have actually proven to be very helpful. There are those people who are having what you might call regular meal a day. Now it's a smart regular meal, lots of vegetables, maybe a bean soup, or as an alternative, a piece of fish or free-range chicken. And then they have these smoothies all the rest of the days, or the power bar. And doing that has actually been shown to be helpful in getting people to lose weight. So I recommend that. In that same direction, here's 4 veggie beef skewers that I obtained in Whole Foods, and these are actually pretty tasty. They taste a little bit like sausage. They are vegetarian. It is a soy product, and I really don't recommend very much soy. I recommend the beans and the vegetables and the grains as such, that concept of foods as they grow in the field. But once in a while, you want to make life easy on yourself. Instead of throwing fish or chicken on the grill, you could throw these and you'd get a little bit of soy. A restaurant that tends to carry really excellent sardines in olive oil I bought some at Stop and Shop the other day. Didn't taste very good, but those that are packed in the olive oil at Tangier's Restaurant right up on Farmington Avenue at Prospect at the Hartford, West Hartford line. And they have other good things. They have chickpeas there. They have other canned beans. They have giant beans. Somebody told me that you can get the fava beans at ShopRite, frozen. You stir fry a little bit of onion and some olive oil, a little bit of salt and pepper, and then you throw in the fava beans, and with that some rice. Okay, so it's white rice, not a big deal. Throw in some vegetables, already cut up collard greens or broccoli and cauliflower, and you actually turn out to have a pretty tasty meal. So for women, there will be the Water's Edge Resort and Spa in Westbrook, Connecticut on October 17th. It's a women's health issue update on designs for health. A couple of drinks a day may keep away dementia. Well, a couple of drinks a day is too many as far as I'm concerned. Heavy drinking boosts prostate cancer risk. Well, alcohol is toxic to bone marrow, heart tissue, brain tissue in any dose. So you have to keep those doses down so you do as minimum harm while you are doing some good. Active commuting is the way to go. They're saying more people ought to walk or ride a bicycle to work. If we all live closer, that would probably be a reasonable decision. This was an interesting idea. Here is a woman who needed a heart transplant, and so what they did is they took her heart out and put in another heart until she could get her own heart back after it had been allowed to rest. Well, I'd like to say thank you and good day, and God bless you all. I've appreciated the opportunity here. Contact Congressman Larson. He is on your side, I believe, and has interest in promoting real preventive medicine. H. Robert Silverstein, MD, for the Preventive Medicine Center.